I am the one who goes to the hospital rooms, who presides over the planning and preparation of funerals in our congregation. Many of those deaths, I believe, are related to diabetes, cardiovascular disease, and a range of other degenerative illnesses that are plaguing our community. There is an epidemic right now in our community. And I believe a part of this problem is related to the consumption of sugary sweetened beverages. You know, I believe we're losing as many, if not more, people to sweets as we are to the streets. And so as a part of my work, it's become important for me to help people understand the relationship between their consumption of Coca-Cola and sugary sweetened beverages and the illnesses they experience today. That work is challenged by the range of deceptive statements and deceptive marketing that comes from Coca-Cola. There is a sense in which people feel as if consumption of sugary sweetened beverages and Coca-Cola is innocuous, that it is almost healthy, that as long as they exercise, then they'll be able to counterbalance any of the harmful effects of drinking Coca-Cola. And I'm a part of this effort to end the deceptive practices of Coca-Cola and the deceptive marketing that's devastating the African American community and the community I serve.
A lot of my time in pastoral care is spent visiting hospitals with persons who have suffered amputations, persons with type 2 diabetes, persons with cardiovascular illnesses, and illnesses related to obesity. And I am here because those diseases and those physical maladies are linked with the consumption of sugary beverages like those sold by Coca-Cola. And this is, for me, an issue of paramount importance and a justice issue, because in the District of Columbia, where I work, where I live, where I pay taxes, more people died of diabetes-related illnesses than AIDS, cancer, and homicides combined. And the link between the consumption of sugary beverages and death is appalling, and we don't hear about it. And much of that is because of the amazing and powerful marketing regime of Coca-Cola, linking consumption of their beverages with fun and with health. This type of mendacity from corporate leaders makes it difficult for me to do my job of not only dealing with people's spiritual health, but people's physical health. The things go together.
The Praxis Project is an organization that works with community groups in DC and also across the country trying to improve health. We especially work with communities of color where some of the health disparities are greatest. And right now what we're seeing is that there is a diabetes epidemic going on in our communities. 50% of African American and Latino children born since the year 2000 are expected to get diabetes in their lifetime if we don't do something about that. That's a big motivation for us. Our children, African American and Latino children, see twice as many ads for sugary drinks than their white counterparts do. And so, we're working really hard to try to counter the messaging by the beverage industry by going out and doing nutrition education and just nutritional awareness programs. But when the beverage industry is saying that sugar calories are just as healthy as calories from almonds, that's a big problem for us. In the years between 2001 and 2011, in that 10-year span, we were at war in Iraq and Afghanistan. And during that period, we had 1,200 of our brave soldiers come back with amputations due to war wounds. During that same period of time in the United States, we had over 700,000 amputations due to diabetes. This is an epidemic that has gone way too far, and we need to get in front of it now. And that's why Praxis is very proud to be part of this team that is trying to hold the beverage industry and Coca-Cola accountable to make sure that they're not misleading with their advertising, especially to our children.
6 blocks east of here, the Tobacco Institute, acting at the behest of the major tobacco companies, for years misled consumers about the health risks of cigarettes. There's no science, they said, linking cigarettes to any human disease. So today, 6 blocks to the south, the American Beverage Association acting at the behest of the Coca-Cola company, is misleading consumers about the health risks of their products. They say there is no science linking soda to obesity, diabetes, or heart disease. Sound familiar?